New event here in the city of Chicago is putting a spotlight on some of the critical healthcare gaps in our healthcare system, especially when it comes to the lack of black representation in breast cancer clinical trials. We're joined now by Michelle Sample. She is the VP with AstraZeneca, and Dr. Paris Thomas, the CEO of Equal Hope. Dr. Thomas, good to see you again.
Nice to see you as well.
All right, I want to start with what is the main goal of what you guys are calling the Rhythm of Chicago Change Brunch?
So I'll start first. The goal is to bring together individuals across pharma, community, physicians to talk about how we can increase diversity in our clinical trials, specifically for breast cancer and Black women. And we know that that is a demographic that we really want to address. Our concerns about the lack of having these women in the clinical trials and the benefits of participating in clinical trials.
Dr. Thomas, what are some of the consequences of not having enough black women involved in clinical trials when it comes to some of their outcomes in terms of breast cancer?
Yeah, so not having representation from Black women in clinical trials, particularly, is that medications are being developed all the time that don't include us. And so ultimately, when we continue to see disparities in breast cancer, like triple negative breast cancer and some of the more aggressive breast cancers, we haven't been involved. And so there isn't medication available because it hasn't been tested. So the importance of getting us involved to participate in clinical trials to ensure that we have medications that can ultimately serve us.
Right now, I'm reading that black women typically make up about 3% of trial participants. You can't make up that number overnight. So where do you start, and what does an accurate goal look like in the next 6 to maybe 18 months to get that number up?
So I'll start. The first is to engage with our communities and have physicians participate in our clinical trials, because the patients that are being seen need to be seen by physicians that are participating in our clinical trials. We need to make it easier for patients to participate in clinical trials, and we've provided things like transportation and care for children, and trying to be more aligned with how patients need to support if they decide to participate in clinical trials. We are tracking information on how many patients and the percentage of patients that are participating in our clinical trials, and we're doing everything we can. This event today was an example of us bringing the community together and hearing what the challenges are so that we can address them.
Who else is joining you guys in this event today? What kind of perspectives and new ideas are they bringing to the table?
I think today included a lot of patient advocate organizations, a lot of the systems. I think one of the main things that came out of this today was really about collaboration and how we can partner with pharmaceuticals to really ensure diversity in clinical trials, specifically using the community and the perspectives of individuals that are considered trusted messengers.
What role do healthcare providers and even some of our local hospitals here in Chicago, what role do they play in you guys' goal of trying to change these numbers?
Well, what we also heard from some of the individuals that I talked to today is that often their physicians don't even broach the opportunity to participate in clinical trials. So what we want hospitals, physicians, healthcare workers to begin to increase, which is to talk to the patients about the benefits and the opportunity to participate in clinical trials. And we heard that loud and clear today, is that often the healthcare system is not addressing that information to Black women.
Oftentimes, we kind of learn by seeing a model working somewhere else. With that said, are there any successful models made or programs happening elsewhere in the country that you can maybe borrow from and use here in Chicagoland?
I think there's several. I think there was a main kind of model that was showcased today, and that was Touch the Black Breast Cancer Alliance. They have a clinical trial. It's called When We Trial, and how they're recruiting women and getting them involved. But we also have amazing organizations here in Chicago that are doing the boots on the ground work and really trying to increase diversity in clinical trials. And those include organizations such as Equal Hope and Sisters Working It Out, Elevated Survivor, and ensuring that we can connect individuals with those partners so that they can partner with the academic centers and pharmaceuticals and ensure we can connect the dots and get people to care in clinical trials.
What's the next step in this journey?
Well, I would say the next step in this journey is always to continue the journey, right? This is the first event that we had here in Chicago. There was an event last year in Washington, D.C. It's to continue to have the conversations, continue to work with our community leaders, our physicians, and make sure that we continue the push for more diversity in our clinical trials, more education around the benefits of clinical trials. And it's science that we need. We need to make sure that the patients that we are going to have medicines for are participating in the research in those medicines from the very beginning.
Now, we know that this trial is specifically focusing on breast cancer. Are there future trials for other diseases coming in the near future?
There are always ongoing trials. And again, I work in oncology, so we have trials for all the indications in cancer, lung cancer, breast cancer. And so it's not specific for just breast cancer. Clinical trials needs to be diverse patients in all of the trials that we're doing across the spectrum of all of the indications that we have.
If somebody at home is watching this and says, okay, maybe I need to get out there and get involved in one of these clinical trials to help somebody maybe 5-10 years down the road, what's the best way that they can reach you guys?
So I think the best way is definitely reaching out to your local nonprofit. You can visit equalhope.org and visit us at contact@equalhope.org, and we can get you connected to clinical trials. There is also websites. What is the government? I'm sorry.
www.clinicaltrials.gov.
All right, thank you.
So I would also add that you can talk to your physician about clinical trials. And if you're diagnosed with cancer, you can also request that you have more information about the benefits and the possibilities to participate in a clinical trial.
All right, Michelle Sample with AstraZeneca and Dr. Paris Thomas, CEO of Equal Hope. Thank you both for your time this afternoon.
Thank you.